Hi, everyone. Welcome to this Partnership for a Drug-Free New Jersey webinar for the Knockout Opioid Abuse webinar series. We're so pleased that you're joining us for this additional resource that we're providing today. And so pleased to have a faculty with us who is a high school senior from Middlesex County. She is working toward her Gold Award for Girl Scouts and is going to speak with us today about overdose intervention. And so I'm so pleased to welcome our speaker, Tanvi Narava.
Thank
Tanvi,
you, Angela.
welcome.
Okay, so like Angela mentioned, today I'm going to be talking to you about overdose intervention. Um, so here's some things we'll be learning about today. One, we're going to touch on what is an overdose, signs of an overdose, how to intervene in an overdose emergency, and some healthy alternatives. So just for some context, Angela already mentioned this, but I am a Girl Scout. I am working on my Girl Scout Gold Award project, which, if you don't know, is the highest, most prestigious award in Girl Scouts. It requires at least 80 hours towards a community service project. So that can be absolutely anything. When I was brainstorming and thinking about what I want to do my Girl Scout Gold Award on, which I had already done my Bronze Award and my Silver Award, I was like, I have to do my Gold Award. I wanted it to be on something in healthcare because that is a field that I'm very passionate about. And I knew I wanted to be something that a lot of people didn't talk about or didn't have awareness on. And then I was researching and talking to local community members. I reached out to a rescue squad in Middlesex, South Plainfield, and actually they had said that one of the things they wish people knew about was Narcan. I did not know what Narcan was at the time, and once I found out what it was, which we will touch on in a little bit, I found it very, very important to be spreading that information and actually educating people on what Narcan is and how powerful it could be. So that's kind of how my project came to be. It's called Renew You, Embrace You, which is all about just spreading awareness and educating specifically teenagers and young adults. I myself, a teenager, a high school senior, I realized this is the age where a lot of teenagers are exposed to substances and drugs and opioids and all of that. So I feel that especially for young adults and teenagers, this information is so valuable as it could make an impact in their life in the future. So to touch on it, what is an overdose? An overdose is essentially an intake or drug or medication that is very high. What does that mean? So an overdose can be when your body is essentially rejecting whatever you're putting in. Overdoses can be caused by different drugs. So a lot of people, when they think overdose, they think drugs on the street, parties, weed, all the very movie-like, kind of like the stereotype that we have when we think of drugs. But that is not true, and that's something I really want to aim with my project, educating that an overdose can happen just from medication, just from taking in like painkillers when you have like a broken knee or something. And we'll touch on that in a little bit more later. But I do think that's very important to recognize that overdose can be caused by absolutely anything and any drug or medication or anything that you're putting in your body. So whether that be prescriptive, over the counter, legal, or illegal, it can have a toll on your body. So 96,700 people die from drug overdoses per year, which to me was like took me back a lot because I was like, wow, like that's not something you think about all the time. Like even now when I look at it, I'm like, wow. It's not, overdoses are not something that's often talking about. Obviously, we have our normal healthcare issues, diseases, problems, whatever. That's very, out there. I think information on overdose is often overlooked. I think overdose itself, the conversations about overdose are overlooked, especially because of that stigma that it's specifically for like parties or on the over the counter or whatever the case may be. I think it's really important that we recognize how big that number is and aim to try and lower that statistic throughout the years. So common opioids, which you may have heard of, is codeine, fentanyl, methadone, morphine, oxycodone. These may just be your average painkillers that your doctor may prescribe to you. It is very common to get addicted through these opioids as they are very, very strong. an addiction can lead to another and a series of events, which can essentially may result in an overdose. So that is very important to recognize. So I touched on this a little bit. So there are many ways opioids are misused. For example, not following instructions from the doctor. It is so important to make sure your communication with your doctor is very clear. I myself, I volunteer in the hospital. We do patient surveys sometimes, and we make sure that one of the questions actually is asking if the patient is in the conversation when they have with the nurses or the doctors about the medication and what they're taking in. It is your body. You want to make sure you know what you're putting in and that you and your doctor have that clear communication to ensure that you're putting in what's right for you. Allergic reactions happen far too often than people think. I know when the last time I gave a presentation, honestly, last Friday, this student was telling me how their teacher actually had an allergic reaction. So it is very common. Sometimes your body just rejects, and overdoses do happen immediately, like it goes right into your bloodstream. So it's so important to know how to intervene, which we'll get there in a second. But medicine misuse, that's the biggest thing I want to really emphasize here. Medicine misuse also leads to overdose. So going back to the idea of like just being on painkillers or getting medication for like a broken knee or ankle, that may lead to overdoses and further problems. So there are signs of an overdose, and you would physically be able to tell if someone is experiencing an overdose. So here's some of the signs. If the person's not responding, let's say you're screaming at them, saying their name, they're clearly not having a reaction or speaking, so slow or not breathing, their breathing is clearly evident and different, making sounds. Sometimes the person will make choking or gurgling sounds, and you can tell something's wrong. Their lips and nails may change color. They may look blue or pale, something different, nothing of the ordinary. Their skin may feel weird, and their pupils might be tiny or dilated. Another thing I do want to emphasize is the situation and circumstances are very important here when dealing with an overdose. If you're in a neighborhood where drugs are, more prevalent, or at a party, like a college party or high school party, whatever the situation may be, and you know that these substances are there, it is safe to assume that this person is having an overdose or a drug poisoning reaction, depending on the situation and, the surroundings as well. But it is very important to know these signs. I know a question I get a lot is how do you tell the difference between cardiac arrest, so when you need to perform CPR, or overdose, because they can look very similar in terms of symptoms and signs. I will mention that overdoses, putting in Narcan to reverse the opioid overdose, does not harm the person. In any case, it's really important to know that, again, going back to surroundings and circumstances, to kind of make that assumption, but performing both won't harm the patient. So going on that, how to intervene. And this was kind of the main goal of my project, how to educate others and educating others on what to do in that emergency situation. So in Middlesex County in 2022, there were almost 1,000 Narcan administrations, which again also took me back by surprise a lot because I did not realize how prevalent Narcan administrations or overdose in general was in Middlesex County actually. And 1,000, if you really think about it, that's 1,000 people that suffered from an overdose essentially, or was affected by an overdose. So it is very common. And unfortunately, the numbers do raise day by day as substances become more prevalent, and it's really frequent. And I really hope that in the future that number does go down. But it's really important that we know that it is in our town, in our community, in our county, and that it's right all around us. So the main substance, Narcan. I do have Narcan with me right now just to show you. Narcan is also known as naloxone, so they're interchangeable. Sometimes people will say naloxone, so like on the box, they'll say naloxone. You can purchase this at a local pharmacy. New Jersey is actually working on this this Be a Hero campaign, which is actually something I've been trying to spread more awareness on. A pharmacy may participate in that campaign, which allows you to get Narcan for free if you just mention the campaign. Obviously, not all the pharmacies in New Jersey are participating in it, but I do think that's something to keep in mind. As well as there are Narcan distributions very often. I know Rutgers, the Health Service Corps, they do Narcan distributions. A lot of local nonprofits or organizations will also be giving out free Narcan. But Narcan itself, it comes in two forms. It can come in injection, but the more common and preferred version is the inhaler, which is just a nasal spray. Essentially, you would just put this up the person's nose. The medication is in here, and you would just push this up just like a regular inhaler, and the dosage would just go right into the person. So it is really quick. It's really, really, really important that you act on immediately once an overdose happens, because it is a very, very rapid process. The drug will go into your system and your bloodstream, and just like that, the person could lose their life. It's so important to know, keep Narcan on you, and I think that's something that I really want to get across, that this is life-saving, and it is very valuable to know how to use. You can get trained in Narcan administrations, which is something I think is very interesting. That's something you're interested in. But anyone is able to just use Narcan as normal. It's really self-explanatory. So like I mentioned, the person may be lying, you'd put it up the person's nose. And I think this is a part that a lot of people forget or may have overlooked, but it's also very important to call 911. 911 should be your immediate go-to regardless of the situation. If, let's say, you're at a party, I know a question that also arises, or maybe some students have concerns about, is what if I'm doing something I'm not supposed to be doing? Will I get in trouble? And there is a law called the Good Samaritan law that actually protects the person. Let's say you're underage drinking, or you're doing weed or smoking something that you're not supposed to. This law does legally protect you. So there is absolutely no reason to leave your friend, essentially to like left out by themselves to die, because you want to be there calling 911, providing that support, finding someone who has Narcan. So in terms of legal miscomplications and all that, you'd be protected. You may get in trouble with your family, but you'd be saving someone's life. So I do think that's very valuable information. So that's something to keep in mind as well. So there are healthier alternatives. A part of my project, since I have been giving this presentation to youth, is just to advise to make good choices, surround yourself with good people. You know what's best for you. I'm not here to lecture you. I'm here to spread awareness and educate you on what the effects and substances and drugs may have on your body. At the end of the day, I understand it's your choice, but it's very important to know what you're putting into your body and what that may look like if it were to go downhill. Overdose is something you never really, again, like I mentioned, not something that's really talked about and people don't really think about. But it is so prevalent in today's day. A lot of celebrities have passed away due to an overdose. For example, the guy that played Batman, he passed away from an overdose. I forget his name all the time, but him. I know Mac Miller passed away due to overdose. So it is very, very, very common. And just knowing what an overdose is and how to counteract that is very, very important. So again, just staying safe, being in good surroundings, keeping yourself in good places, in parties, making choices for yourself. I know peer pressure is a thing, unfortunately, but we want to make sure that you're making the right choice that's for you, because at the end of the day, it is your body and it's going to have an effect on your body. So here are some resources of just some website links and some other information about opioid overdose, and some statistics. Again, I think these are really important to check out. There is so much information out there. And I think that it's really valuable to have a glance and, talk about it, think about it, and see what they have to say as well. So just kind of covering what I've been doing with my project. I've given this presentation to maybe over 100 students in the past couple months. I started off at my school. I did a presentation with the freshman seminar with 60 students, and it was very, very exciting. And I realized the value of my work. I mean, obviously in the beginning I was very passionate about it, but as I kept doing it, I was like, wow, like this is truly every time I give the presentation, I'm like, this information is so, so important. And it's so important to me to make sure that this is being conveyed to the right audience and the people that need to hear it. So a part of it is I work very closely with Wellspring Prevention Center, the coalition, Ms. Sharonda, the coalition coordinator. We work very closely, and she actually helped me organize a flag ceremony over the summer, which was one of my big highlights of my project so far. Definitely the most rewarding thing of my summer. It took a lot of planning, a lot of, lots of things to do to actually get it to, execute it. But a lot of people came. I had over 60 attendees, and in retrospect, I just this information itself, like the purple flags represent the people in Piscataway who've been affected by overdose in the past 5 years, and then the white represent those who've passed due to overdose in the last 5 years. The mayor came, and we had people talk about their personal experiences. A lot of the sheriffs and councilmen came, and overall it was a really good community gathering to just kind of spread awareness. This is the first time Piscataway has done something like this, so I'm really looking forward to doing the same thing next year, as it is now an annual ceremony, which I'm really excited about. But the work was very rewarding, and I see the results and the information and the students that I've been educating, so I'm really happy about that. Um, so that's kind of been what my goal of the project has been, and kind of where I've been so far, just giving constant presentations and educating, and trying to spread as much information I can, whether that be through social media or presentations or webinars, whatnot. Here is my Instagram, which I actively use to spread information. As you can see here, the Be a Hero campaign, which is something I mentioned earlier about the local pharmacies getting involved. Here's something about Narcan. We do street fairs, just local organizations, working with them, and events. I think that's really important to get the community involved. So that's kind of what I've been doing with the project. So that concludes my presentation. I want to thank you guys so much for listening. And thank you, Angela. I'm going to head it off to you.
Thanks so much, Tavigan, and thanks for that great information, important information, particularly for your peers. Additional resources are available on drugfreenj.org or on knockoutday.drugfreenj.org. And I know that you put some links to some resources. We'll have those in the description of this presentation for anyone who wants to click on those resource links. But once again, I want to thank you for all the work you did on this presentation, and wish you the best of luck with your Gold Award. And just know that sharing this information and the work that you are doing and have done will ultimately reduce stigma and save lives. So thank you. Thank you for that.
Thank you, Angela. I really appreciate it.
And thanks again for everyone who is tuning into this resource. Again, if you're looking for any additional information, I invite you to join our monthly webinar series. You can find out more at drugfreenj.org or at knockoutday.drugfreenj.org. Have a good day, everyone. Be well.